Canada's COVID-19 vaccination campaign is underway right now, so we brought back our expert to help answer some of your questions about the vaccine that you're probably wondering about and the pandemic in general. Infectious diseases specialist Dr. Bogoch is joining us this morning. Hey, nice to see you.
Good to see you as well.
All right, let's jump right in. Our first question comes from Instagram, and here it is. If you have already had COVID-19, do you still need to get a vaccine?
That's a great question. The answer to that is very likely to be yes. We know that people who have had this infection and have recovered from this infection have actually been reinfected. And there's several credible cases of reinfection on the planet. And of course, we know that those credible cases of reinfection are pretty much the tip of the iceberg. It's probably happening a lot more frequently than we would think. So if people have had COVID-19 and have recovered from it, they will very likely be eligible for vaccination when it starts to roll out in their communities.
All right, this one from Facebook. Here's the question. Can they give this vaccine to people already in the ICU with COVID?
That's a really good question as well, but the answer is no, you cannot. And you would wait for someone to have recovered from their critical illness, to be released from hospital, to be well, and to be, just in generally good health before they got the vaccine. So you wouldn't give it to someone who's sick in hospital with COVID-19. You'd wait for them to be discharged from hospital.
A viewer asked this. I'm allergic to non-steroidal anti-inflammatory drugs. Can I still get the vaccine?
Oh, this is a very timely one because we saw those 2 allergic reactions in the United Kingdom. Haven't seen any so far in Canada just yet. So the answer to that is very likely to be yes. I got to be careful with my words. You are very likely to be able to get this. Now, on the Health Canada website and on many other credible websites, you can see all the ingredients of the COVID-19 vaccine. And if you're, of course, allergic to any of those ingredients, you should be getting this vaccine. And luckily, we have other vaccines that are in the pipeline and that are hopefully going to be available in Canada soon. And of course, when you look at those ingredients, you say, well, I don't know what that is, and I don't know what that is. So this is something that you can really sit down with your frontline healthcare provider, speak about what your allergies are, and then look at what the allergies are on the Health Canada website or any other reputable website to see if this vaccine is okay for you. And I think the vast majority of people, even the majority of people with allergies, will be able to get this particular product. But of course, this is one of those things where you have to speak with your physician about just to make sure.
Yeah, talk to your doctor. This next one, why aren't COVID-19 cases in Ontario dropping after lockdown measures were put in place? And doctor, is the goal to have cases drop or just to slow the impact on hospitals?
Yeah, good one as well. So, Ontario and many other parts of the country are in a very challenging position now. We're seeing pretty high cases in Ontario, for example, and many parts of the most heavily impacted parts of the province are in lockdown. So why is this the case? What's actually happening is rather than cases going up, the lockdown has actually slowed the rate of growth. And we've kind of plateaued in this, 1,600 to 1,800 new cases per day range, which is not okay. That's not okay. But what we're not seeing is exponential growth going up. And that's the lockdown. And, I know lockdowns stink, and we know about the psychological and economic and health repercussions of lockdown. They're terrible. But that's why the numbers are what they are. It's different from the lockdown we had in March. Kids are in school. There's more people at work. There's great data demonstrating mobility of people now compared to the earlier lockdown. And there's a reason why the numbers aren't going down. And I mean, we can dive into that, but a lot of them are what you were discussing before, which are largely related to inequities related to health and work and putting people at risk for getting this infection in the community, essential workers, for example.
Dr. Bogoch, it's always good to have you on to answer these pertinent questions, and there'll be more to come, so we'll see you soon. Thanks.
Have a great day.
You as well.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.